Hi everyone, welcome back to Recovery with Nurse. In this video, we're going to take a deep dive into how to give yourself medications, waters, and food through your G-tube or J-tube that you received in the outpatient setting or in the hospital. Let's first go over the supplies that you'll need. First, you're going to need a little cup, a crusher, a syringe. We have the in-fit syringe. We also have a regular syringe. You might need one or the other, and we're gonna tell the difference. For the in-fit, you're gonna need this kind of valve. For the regular Lopez valve, you're gonna need this. You're gonna need a little cup. Medications, whichever medications doctors have prescribed for you. It might be a syrup or a liquid form, so we have that as well. And of course, we'll have your G-tube. We have a little adapter here we're going to talk about later in this video. Okay, let's pretend that this is your G-tube or J-tube, and yours might be shorter or longer. It really don't matter. Yours also might or might not have a little clamp here. Here we have two different types of valves here. We have a in-fit Lopez valve, and we have a regular Lopez valve. Sometimes we call it a orange valve or purple valve. And essentially they do the same thing, but as you can see, this has a little groove on each end, and this is just a regular twist off. The adapter I talked about, this handy little adapter. Now, when your G-tube does not have an end or adapter, and you want to use you have the end-fit Lopez valve, it's really hard to connect these two together with great fit, and it might come off very easily. In that case, this adapter can be really helpful to really secure this in place. Then you will attach the end-fit Lopez valve like so and twist. Okay, now you'll see that you have a valve here, and it's a twist-on valve. And as you can see, we have an off position, and we've got 3 arrows here. Depending on how this arrow is placed, the water can flow, or water, food, or medications can go in different directions. For example, if off position is to you, remember, you have the G-tube, so you're on the left side of me. So you have the G-tube, and you have the off position to you. That means nothing can go in and nothing can come out. Again, off to you means nothing in or out. And as you can see, we have 2 additional ports here. Only one will come with a cap. Okay. So now, let's say you're giving yourself water. And for in-fit valve, you're going to need the twist-on syringe. You can't give yourself anything with the regular syringe like this because it's not a twist-off. It doesn't matter. You can either use one or the other. Let's say you have a cup of water. You're going to draw 30 cc of water, and that's 5, 10, 20, 30. You're going to connect one end, twist on. Before you give yourself the water, the 30 of water, you have to change the position of the valve. So again, off means nothing can go in or out to you. We have to twist this valve. So just imagine how this will go. If you have the off to you, that means the water will flow into all available ports here. So if you accidentally push water right now, let's say you do that, the water will flow to this port right here. You will definitely wet the bed or mattress. So before you give yourself that water, you have to remember to change the position of the valve. So off to the on the valve you're not going to use, which in this case is the top one. So at this time, you are open, so water can go in and to you. So right now we're going to do that very slowly. Again, we're going to pretend that this is water. So now, before you twist this off, remember this is open theoretically. So once you twist it off, and if you didn't close that valve, you're going to let that water or whatever you pushed in back out. So before you untwist the syringe, you have to remember to close the valve back off to you. Remember that. Now again, this port and this port is exactly the same. So you can theoretically use this port. So if we wanted to use this port for some reason, then you can also do that by just imagine where this would go if you push that in. If you push the water into this port and without changing the valve, the position of the valve, then if we push the water, then it'll come out this way. Make sense? So let's say we have water. We're going to change the position of the valve again to the port that we're not going to use, and then you're going to give yourself that water slowly. Again, you have to close the valve back to you to make sure that you're not going to get that backflow. We're going to change it up and use the other Lopez valve, in this case, this one. Now this one has that adapter looking piece already attached. So we're just going to attach this, give it a nice twist, and that's pretty simple. And most of the time, this will be off, and you have to push this in. Remember that there are two ends here, and they have slightly different anatomy inside. Just remember that the ring tip is towards the valve, not this way. Just remember that. The one with the ring tip goes in the valve. Okay, so just like you remembered, now we have to remember that off, when you first begin, off should be on towards you, so then nothing can flow in or out. Now in this valve, with this Lopez valve, you're going to need the regular syringe. And also, it might be a little hard to see in your video, but you do have the measurements here as well. You have the 10, sorry about the glare, 10, 20, 30, and so forth. These are both 60 ml or 60 cc syringes. So let's say you're giving yourself 30 of water. Remember, you're getting regular water. A lot of people ask me, what kind of waters do I need? Do I need sterile waters or distilled water? Absolutely not. You and I don't normally drink distilled or special or sterile waters at home, and so do everyone else. You're just going to need clean tap water or clean filter water. So let's say you're drawing 30 cc of water. Now, again, just like the other valve, you can use either of the ports here. Let's first use this guy. You're going to turn and twist. Now, what should we do? You have to change the position of the valve again. Then give yourself water, food, or medications. Remember, you have to really push slowly. And later, I'm going to show you how to use gravity to your advantage. Now that I gave water, again, you're going to change the position of the valve, turn the valve, then twist off. Now say you want to use this port. We have a little cap here. Remember to keep that cap at all times. Okay, now again, let's say we're giving your water you're gonna just really push that in. Don't need to twist that hard. To which direction should you turn this valve? I'll give you 2 seconds. Right, we have to turn the off to the unused port, which in this case is this one. Then give yourself the water. And before we take out syringe, we're going to turn the valve again. Just like that. And take out the syringe. And make sure you put that cap back on. So easy to get this misplaced. Now that we have the basics down, let's get down to how to really give yourself water, medications, and food. So let's actually prepare that. We have a pill crusher, which in this case I have this one. Yours might look a little different. If you have the fancy one, you might actually have a splitter or cutter combo, which I really prefer. Say we have, let's say 2 taps of Tylenol. Let's say we have gabapentin 300 milligrams, which is not, but we're just going to pretend that this is gabapentin. And let's say we have a syrup, liquid Tylenol or what have you. Let's say this is the right amount. First of all, we have a regular whole pill. We have to make sure to crush really fine. Give yourself nice crush. Medications, really fine medications. And the only way to tell is by looking underneath and see how fine it is. If you see coarse pieces, then you want to give yourself more twists. Make sure it's really fine. So just go back and forth until it's really fine. So let me show you. That's pretty good. So we're gonna use this cup right here as our medication cup. So we're just go ahead and pour the content into this cup, cap it, store it away. Now, if you have any capsules, obviously you're not gonna crush this one. You're going to open the content of the capsule straight into the medicine cup. Just give it a squeeze or two until empty. Then you have liquid medication. Now you're going to mix a little water into this medicine cup. Give it a nice turn. Depending on how thick your medications become, you might need to adjust the amount of water you have to give yourself. So right now, let's give it a nice couple swirls. Let's try to mix this medications really well. One of the most difficult things inpatient or at home is unclogging the G-tube or J-tube. Make sure this mixed medications with water is fine and that there's no coarse pieces within your syringe. Otherwise, it might get stuck. There are some really cool ways to declog your tube, which I'll get to that later. So stick around in this video. So just go back and forth. And right now, as you can see, this is pretty clear. Yes, of course, you'll see the little pieces, but this is, to me, this will definitely work. If you see that this is the consistency of your medications are too thick, consider putting back the medications, add some more water, then actually give yourself that medications. You're going to expel the air that's within the syringe. So just gently push out the air by pushing up on the syringe. It's just going to make you, it's not going to be lethal or anything. It's just going to make you more gassy. That's all. And if you actually push out the excess too much, like I just did, then all you're going to need to do is get them back. That's all. We have the medications, and you'll see that's a little bit of water. But I've done this many times that I know I'm not going to give that much air back into myself or to anybody else. I'm not sure if I already went over this, but the rule of thumb in terms of giving yourself anything is give yourself 30 cc of water before and after. So before you give yourself, let's say, medications or liquid food, give yourself 30 of water. Then another 30 afterward to make sure that this tube stays clear and patent. So let's go back. We already have the waters in. So we're going to twist this on. Now we're going to turn the valve to a unused port. And I'm going to make sure I'm not going to squirt myself. So I'm going to put that back in here. So you're going to then squeeze and push slowly the content. Now what I like to do, instead of inverting the syringe all the way, hopefully you see in the camera that the medications are so concentrated at the syringe, at the tip of the syringe, at the bottleneck, that if you have a little bit of coarse pieces of medications, it's going to get stuck either at the tip of the syringe or in the tube, in the gastric tube, or in the valve somewhere right here at this tip. So my trick, I've done this many years now, is that I keep the syringe sideways. You see how the medications are evenly spreaded throughout the syringe and not concentrated at the tip? So I'll keep that kind of sideways. You can tilt it back and forth, right? Then gently push on the syringe. Now remember, if you're doing this and at any point you feel nauseous or you feel sick to the stomach or you feel like that's too much pressure, then definitely ease off and you can stop at any point. Keeping this level, go ahead and push on the plunger. And at towards the last minute, you can just tilt up and give yourself the last bit of medications. And like I said, this little bit of air will definitely not hurt you, but I'm not going to do that. Right now, after we gave the medications, we're going to turn the valve again, back to me. Or your loved one, your family, your mom and dad. Then twist off, get water again. Let's say that this cup had water. We're gonna pull back on 30 cc of water. This is air, but let's pretend that that's water. Again, turn the valve, push the water. So now we're finished. We're gonna turn the valve off to you and remove. Okay, lastly, I want to show you one last trick. And this is my favorite one, so stick around. Switch it up and use the end-fit Lopez valve. This method can work with any type of valve, whether it be the purple one or the orange one. As I mentioned earlier in this video, if you have the clamp one, if your G-tube or J-tube has a clamp, make sure you clamp and unclamp as you need to. Because otherwise, let's say you open this up and you're trying to give yourself water and you're like, oh, that's too much pressure, what's going on? But you're clamped at the G-tube side. So remember to clamp or unclamp as you need. Last trick, like I mentioned, and that is by gravity. And if you are a trach patient or a laryngectomy patient, please listen carefully. Not that any other type of patients will benefit from this, but if you are especially trach and Larry patients, then stick around because this will be very important. I'm going to draw 30. Using gravity is super important for those type of patients, as I mentioned, because you don't want to create more pressure. For those ear, nose, and throat patients, please use gravity method instead of the pushing method. So remember we pushed the medications before, like this, pushing on the plunger. Now, this gravity method is used like this. What I do is pull back on the plunger all the way. So my black rubber is sitting at the edge of this syringe, this plastic piece here. As I pull back on the plunger, so there's a lot of air. Of course, we're not going to push all the air. We're going to let gravity do the work. So we're going to twist this on. We're going to turn the valve and literally let gravity do its work. What we're going to do is pull back on the plunger all the way. And we're just gonna let gravity do its work. Invert the syringe and let gravity do its work, just like that. Let me show you that again. We have the syringe. And what we're gonna do is literally pour water straight into the syringe without the plunger. I gave myself a little more water. Oh. Okay. It's a perfect example of what not to do. You see how I didn't close it right and I pulled back on the plunger and the water is flowing out this way. If I remove this cap, then I'll definitely make a mess. So what I'm going to do is turn the valve, right? So now I'm letting gravity do its work. And if I lower this cup of mine here down, then we're just gonna watch water pour right into the G tube. See, I'm not doing anything. I'm not like actually pushing back on the plunger. I'm just letting gravity do its work here. Let's say this is my stomach and it's getting full because of all the waters and medications I'm giving myself. So again, gravity, super, super easy. So of course this works with not only water but medications, liquid food. Let's say you have diabetes and you're prescribed diabetic source. Then all you're gonna do is pour diabetic source cans straight into the syringe here. Now, my last trick for you is that sometimes you might need to give yourself a little kick. And what I mean by that is that even though your G tube is clear, your clamp is unclamped, your valve is to the right at the right positions, and you're not watching this go. You're not watching this go down by gravity. And you might be wondering how or why. And that is just purely by physics and just basic plumbing. You just might need to give yourself that extra little kick by pushing on the plunger very slightly, just like that. And then just pull back and you'll just let water go down easily. So that was my most comprehensive education on how to give yourself water, medications, and food through the G tube using the N-Fit Lopez valve and the regular orange Lopez valve, showing you with two different syringes. If you found the content very helpful, please subscribe. Follow for more nursing related content. Thanks for watching. Hope to see you in the next video.